Thank you, Mr. Chairman. These are my disclosures. I was sponsored by Astellas and Pfizer to come here. This was not the slide that I submitted. So this is a post hoc analysis of 2 trials that evaluated the efficacy of botulinum toxin in OAB patients by incontinence severity at baseline. There are 2 phase 3 randomized clinical trials. Initially, they were published, which showed that they significantly reduce urgency urinary incontinence, improve quality of life in patients with OAB. And these patients were unresponsive or could not take antimuscarinics. Patients were grouped by urinary incontinence severity at baseline. There were 3 groups. 2 or fewer urgency and urinary incontinence episodes per day, between 2 and 5, and more than 5. The assessment was at 12 weeks to establish the mean, the absolute and percent change from baseline in urinary incontinence episodes, the proportion of patients with 50% or more, and 100% reduction in urinary incontinence episodes per day, the mean change from baseline in IQOL score, and adverse events. These are the graphs looking at the mean change from baseline in urinary incontinence episodes, and you can see that there's a consistent decrease in the number of episodes. It's variable and it's determined by the baseline. The actual percentage is relatively similar as far as here's the pooled results, and here are the 3 different groups that are looked at. Looking at 50% or more urinary incontinence reduction, it's fairly consistent as far as numbers, percentage of patients with the 3 groups, 2 to 5, and 5 or more. However, with 100%, although it's lowest in the 5 or more, highest in the lowest group, the actual relative risk was highest. That's the odds ratio of being is highest with the greater than 5, because that's relative to placebo, and there were fewer numbers, but there was a greater response. Looking at the IQOL as far as quality of life, all of the treatment groups were well above the minimal important difference relative to placebo. Adverse events, specifically note UTI, which was actually highest in the 5 or more. It was 25%, but that was also seen in the placebo group, 10 versus much lower, because the 5 or more than 5, had the highest number of older people. On definition, it was about 20% in that group. There were no other signals from this analysis. So across all subgroups by baseline UI severity, OnabotulinumA treatment resulted in significant reductions in incontinence, substantial and clinically relevant improvements in quality of life. Patients with less severe incontinence at baseline had the highest dry rate. The odds ratio for becoming dry with OnabotulinumtoxinA versus placebo was the greatest for patients with more than 5 UI episodes per day. In both the placebo and treatment groups, patients with more than 5 UI episodes per day had the highest rates of urinary tract infections than those with less severe incontinence, and that's probably attributed to the age. The incidence of all other AEs was generally similar across the subgroups. Thank you very much.
Thank you, Sander. Do you advise your patient differently now that you know all of that? Do you advise your patient differently? Do you inform your patient about the risks and the failure rate and the infection rate?
Well, I think that it tells us that there is a correlation between number of episodes, age, and perhaps baseline urinary infections, but that was seen in the placebo group as well. I think this just tells us that even if they have substantial urinary incontinence at baseline, they still run, there's a reasonably good chance of a response.
Do you observe any difference in urodynamic parameters, or haven't those patients been urodynamically investigated?
It wasn't a urodynamic study.
No, okay.
It was an OAB trial, and there were no urodynamics done as part of the inclusion criteria.
And I see you have always around 50% improvement throughout the groups, independent of severity of urinary incontinence. So isn't that somehow strange that Botox treatment always leaves a 50% rest problem? Doesn't matter of incontinence severity? I mean, if it's so powerful to reduce 4 incontinence episodes in a patient with 8, why doesn't it is also powerful in patients that are only 2? It only leaves 50% rest.
Well, it doesn't work as well overall for the ones who are very severe. But again, this is a range of responses. For some patients, it works extremely well. For others, it doesn't work as well. But despite that, there is, across the populations, a relatively good response.